So what happens next? You are going on to residency, and then perhaps fellowship. It seems a pretty well-defined path, and you will certainly be busy and immersed. Actually, you will be completely consumed. But all of us who were once in your shoes know that there will still be at least one big question for you. It will be in the back of your mind almost every day. It will be your 800-pound gorilla. How will you have your impact? How will you have your impact? From the first day that you donned your white coats, we have seen what you are capable of. We have seen your focus and drive and leadership instincts, so we know you have the capacity to improve the human condition. Isn't that really why you have been working so hard this last 4 years, this last 8 years, and even before? I want to say something more about this big question, but perhaps I can frame it in a way that is even more meaningful for you today. What will be your calling? For many of us, your faculty, we have jobs and careers, but what we find to be the most wonderful blessing is that what we do at work is a calling. Every day, in some way, we feel like our work is making a difference for people and the world around us. And it is that feeling that we wish for each of you. Why am I so sure that you can find your calling and have an impact? It's not just that I know about your capacity. It's also that I know how much the worlds of healthcare and biomedicine need you, your ideas, and your talents. We still know far too little about human disease and how to reduce pain and suffering, and you heard some of that from Dr. Wen. We have epidemics of diabetes and asthma, and still so many in our family are dying from cancer and Alzheimer's disease. We have newly emerging infections every year like Ebola and Zika, and we're running out of ways to treat antibiotic-resistant infections. We have more than 20 million people in this country suffering from substance abuse and addiction. We still don't know anything about how to help parents take care of autistic children. We are failing in behavioral health in so many ways, including veterans with depression and post-traumatic stress syndrome. The timing could not be more exquisite. I truly believe that you are at a tipping point, at a time in which truly revolutionary discoveries and changes in healthcare are possible. We're just beginning to realize what we can do with gene sequence data and a new paradigm for redefining disease that's based on personal genomic variations. Gene editing techniques are allowing us to create models of human disease that were never before possible. We are at the cusp of using our understanding of the microbiome to do something about malnutrition and obesity and autoimmune disease. The power of our basic science is simply breathtaking. I recently listened to a young neuroscientist describing his work on the biochemical basis of memory, what molecules change in neurons. Imagine having the ability to describe at a molecular level how a memory is formed. On the healthcare side, we urgently need innovations to reduce cost. Healthcare now consumes 19% of the gross domestic product of this country, and there are estimates, probably underestimates, that taking care of Alzheimer's disease alone will cost our next generation $1 trillion per year. So we need leadership in innovation and at the same time reducing the cost of healthcare. And who better to do that than graduates of Washington University School of Medicine? What will be your calling, and how will you realize it? For me, it happened several years after I graduated from medical school. I knew when I graduated that I wanted to help families with sick children, but I had no idea how I was going to do it, and really no idea of what I was capable of. I had incredible experiences at Children's Hospital of Philadelphia. We were taking care of very sick children from the poorest of neighborhoods in West Philadelphia. It was not everyday stuff. For the families from West Philadelphia, it was obvious that we were essential to the survival of the most precious thing in their lives, their children. During my residency was the height of the epidemic of Reye syndrome. Reye syndrome is very rare nowadays because we learned that it was largely produced by aspirin, somehow interacting with mitochondrial metabolism, only affecting children. It was an absolutely terrible problem associated with marked intracranial hypertension, and it affected mostly healthy older children and adolescents. Nobody knew what to do about it. In our hospital, the intensivists tried pentobarbital coma, hypothermia, and later craniectomy, removing a part of the skull to relieve the pressure. And none of it worked. At one point, we would walk into the pediatric ICU and there would be 15 children with part of their cranium removed, about to die. It had a profound effect on us. And I say us because I met my wife there, and now we have been married for 36 years. And in our lives together, we have shared that deeply meaningful feeling of how our work mattered for families. We then went to Boston Children's Hospital as fellows, and that is where I came to see my calling. For my fellowship research experience, I worked with a brilliant professor, and eventually we decided that I would work on something called alpha-1 antitrypsin deficiency. We knew that this disease caused liver failure in some children. Liver transplantation was just starting to become effective, but insurance companies were not covering the liver transplant, and so if the families couldn't raise $300,000, those children could not get that care, and they were left to die. For my project, I needed cells from these children, and I would drive all over New England to their homes to collect the blood samples. I would find myself in a 1- or 2-room apartment in a very poor neighborhood. I would have to use a kitchen table and the help of the mother to draw the blood from the child. On many of these occasions, the whole family would be there in the kitchen, watching and helping me and expressing gratitude that I was working on the problem. I experienced something that I had not expected. And this experience, not a day goes by that I am not reminded of it. They had to deal with the knowledge that nothing could be done to save their children. They could have been so frustrated and resentful, and yet they were thankful that there was a doctor who has promised to work on the problem. And since then, I've had so many experiences with families for whom the work in my lab was meaningful and special. And now, years later, I can tell you, with work with my collaborators, that we have a pipeline of drugs and one drug in the clinical trial that may prevent liver failure in these children. To the class of 2017, I promise you, if I can do that kind of thing, so can you. And if my mother was here today to tell your parents, she would say, I still don't understand what he does, but if he did it, you can do it. What will be your calling? Jordan Stanley and Jessica Fan. You are among your peers going into neurology. Are one of you going to help solve the devastating problems of Alzheimer's disease? Kevin Cross, Agnes Dardis, you are going to be surgeons. Will you follow in the footsteps of Tim Eberlein, who has worked tirelessly to improve care for women affected by breast cancer. Tim will tell you that we desperately need to identify signatures, genomic or epigenomic, which will distinguish women with truly progressive breast cancer because we are overtreating 70 to 80% at great cost personally and financially. Giuseppe D'Amelio and Tim Lauman, you are among your peers going into psychiatry. Will you lead in helping to develop systems providing better access to behavioral health? Or get into basic research to discover cures for schizophrenia or targets for treatment of autism? Taylor Geisman, Ethan Tobias, and Janice Kim, internal medicine. We hope that one or more of you will get inspired to do something about public health issues, like our guest speaker, Lena Wynn. Or maybe you will follow in the footsteps of Vicki Frazier, trying to develop new ways to prevent infections in hospital. Lindsay Burton and Miriam Ben Abdallah, you are going into OBGYN. Can you help us to develop programs that will prevent premature labor? Hillary Gallen, anesthesiology. Can we develop better drugs for pain and anesthesia that are lower in addictive properties? Ken McNeil, Austin Wesovich, and Anita Chari, are you going to take your passion for global health to impact the poor and underserved in the greater world around us that so desperately needs advocates? And please never forget the lessons you have learned here from your teachers and mentors about compassion. This is such an important part of your education so far, and you must keep working at it. When people come to you for medical care, they are always at their most vulnerable. In many cases, it is not just your skill and your knowledge, but the little things that make a difference for your patients, knowing them, being there at the critical moments, giving them confidence that the next step is the right step. You will be surprised at how important these simple things are to families at vulnerable moments. I love how this is described in Atul Gawande's book, Being Mortal, and so we have left a copy of the book for each of you at your seats as a gift from the school today. I want to end with one of several great comments made by John Lennon. Yes, John Lennon of the Beatles. He had so many great songs, and I love all of his off-the-record comments. One of his best is, "Life is what happens to you while you're busy making other plans." But the quote that I want to give you today goes like this. When I was 5 years old, my mother told me that happiness was the key to life. When I went to school, they asked me what I wanted to be when I grew up. I wrote down happy. They told me I didn't understand the assignment, and I told them they did not understand life. It's now time for each of you to go on from here, to find your calling and to fulfill it, always with compassion. We know you can do it, and we know with those things you will live a life that John Lennon's mother envisioned for you, a happy one. Congratulations, graduates of 2017.